Frangelina, you can start.
Good day and welcome to this session of the Summit 2021 Annual Conference with the theme focusing on growing medtech industry, post-pandemic, adaptability, resilience and sustainability. My name is Frangelina Boitumelo, member of the Summit Regulatory Committee, and I'm pleased to facilitate the session that will focus on South African Health Products Regulatory Authority. Please feel free to post your questions and comments on the chat or the Q&A panels, but this will be addressed at the end of the session. I think we're all in agreement that the pandemic has shaken the health ministries and regulatory authorities all over the world. And here in South Africa, the telescope lens turned and zoomed into SAHPRA because of its crucial role in the response to the pandemic. In this session, we will examine the transformation journey from the Medicines Control Council to SAHPRA. We'll clarify the role of the SAHPRA Board, its strategic intent, the challenges, as well as the successes within the pandemic and beyond. To provide us with this overview, I'm pleased to welcome the CEO of SAHPRA. Her children have nicknamed her meeting because she spends a lot of time engaging and listening to stakeholders on virtual platforms, which is her mandate. She holds a degree in genetics, a PhD in biochemistry, and MSc in management, finance, and investment. She's also a fellow of the African Leadership Initiative. Within the technology innovation space, she managed a biotechnology incubator at the Innovation Hub Management Company. She was with McKinsey and Company for 2 years as a McKinsey Leadership Fellow, but prior to that, at the CSIR as a senior researcher. With that, I ask you to give a warm welcome to Dr. Boitumelo Semete-Makokotlela. Over to you.
Good day, everyone, and thank you for the warm welcome, Ms. Boitumelo. I really appreciate it. I will go straight. Can you hear me?
Yes, I can hear you.
Okay, I'm going to go straight into my presentation. Just for, let me stop the video so I don't have issues with bandwidth. That's it. So thank you again for the warm welcome and for having SAHPRA join this very important webinar that is participating in this. And I think this demonstrates just SAHPRA's commitment to engage with, and as Ms. Boitumelo said, really listen and hear what are some of industry's challenges, what are their concerns, but also advice to us as we regulate this area. So this is an area that is governed by 2 acts, the first being the Medicines and the Related Substances Act of 1965, and this was amended in 2017, and the amendment also included regulatory oversight over medical devices as well as IVDs. Many of you are familiar with the Act, and one element I'd like to highlight is that it enables us to cooperate with other regulatory authorities and apply reliance on work that they've already conducted. The other Act that has relevance to what we do largely been utilized in the area of regulation of non-ionizing radiation emitting devices as well as radioactive nuclides. And this is the Hazardous Substances Act, Act 15 of 1973. And within the Hazardous Substances Act, it talks to how we should be efficient, effective, and ethical in evaluation of these medical devices and IVDs. The Medicines Act defines what these are. So these are any instrument, apparatus, implement, machine, etc., that are utilized, for purposes diagnostics, diagnosing, so to say. And those two acts continue to be, and we've started a project to amend those acts, but also to bring some harmonization into that, and I will allude to that later on in the presentation. So as indicated earlier, we were launched as the South African Health Products Regulatory Authority from 2018, wherein we were replacing the Medicines Council. And our vision as SAHPRA is that we want to be agile, we want to be responsive as an African health product regulator, but also to ensure that we are globally recognized. Very important is also that we want to be an enabler in the sector. So we don't want the regulator to be a barrier. And hence we consult so much, with industry so that we can really get a sense of what you're grappling with, and that we could position ourselves as an enabler while we still are very firm on our position as, a gatekeeper as the regulator. Our mission is really to promote access to health products, both human as well as veterinary health products. I just want to reflect on our values, and again, some of these still remain to be aspirational, but across the organization, we have agreed that these are the values that we're going to subscribe to. These are values of Ubuntu, responsiveness. So you see that come through again, responsiveness. We really want to ensure that some of the complaints that we've had and challenges that we've had, we address that and that we're more responsive. We want to operate with integrity, transparency, efficiency, as well as through excellence. As already alluded to, our mandate has been expanded since we were set up as SAHPRA, and now include, in addition to human medicines as well as veterinary medicines, we now also have oversight over medical devices and IVDs, and within that, radiation control. And the other area that has been included in our scope is regulatory oversight over complementary medicines. In terms of regulation of medical devices, and I'll do a bit of a deep dive here, the regulation of medical devices, as indicated, is under the authority of SAHPRA. Depending again on the product, you may need to get certification from the Bureau of Standards or the NRCS. In terms of the areas that we regulate, it also includes radiation emitting products. And this is an area that was initially within the Directorate Radiation Control that was at the Department of Health. So it's now all under SAHPRA. And as I've indicated, we have started a process really to harmonize these two acts and to see where we create better synergy around that, because it has posed some challenges. We've had some of the industry members saying there are elements that require then compliance to both of these acts, on a single product, and yet it's one regulatory authority. So we're working hard on those matters. In terms of what we will and what we are regulating in medical devices, we really are concerned with enabling patient access to high quality, safe, and I guess effective or performing medical devices. We want to avoid access to unsafe products because this does pose a risk. And also we want to protect, those who utilize these products, the patients, the public, as well as the environment. So issues of, waste management, etc., becomes quite important, particularly in the area of radiation control. So we regulate by issuing licenses to manufacture, import, export, distribute for wholesalers. Again, this is what we've largely been conducting at the moment. Unlike for medicines where we go out and we do, the actual inspections, for now we're still doing the licensing by an attestation model, and this will change with time as we strengthen our capacity and capability within the medical devices. But again, communication will go out to industry in this case. The other matter around licensing, again, is we understand that there are instances wherein, there's a bit of a gray area in terms of a distributor and a wholesaler, and these matters again are being addressed, and maybe Dimakatso would have addressed it. So a number of you are aware of the regulations that we published. We received a lot of comments, and thank you for that. We're busy going through that, and we will be having a workshop. Dimakatso indicated that that's coming up quite soon, where we will give you feedback on this. And once we then finalize that process, we will then gazette the regulations. So what that means then is that it will then enable product registration. So we do expect that we will gazette the regulations post the workshop we'll have with industry, and probably early Q1 of next calendar year. With that, then what will follow is a product registration call-up notice. And again, we will look at a risk-based approach in terms of the classification and which classes will we call up first. And again, as per our regular practice, we will engage with industry on this, and there'll be clear alignment on the process. Very important, an element that we need to pay a lot of attention to, and I think the COVID pandemic highlighted the need for us to build resources and capability in this area, is around post-registration oversight. From a vigilance perspective, having to guard and assess the products. We've seen, those who were not quite familiar with the Act advertising classes of products that they are not, allowed as per the Act to be advertising those, etc. So we are finding that there's a lot we need to do around the post-registration oversight. And then very similarly then with the Hazardous Substances Act, the license for that is to import, export, manufacture, sell, lease, install, etc. For the specific groups of products that we then regulate. What we've seen with COVID was really an increase in the issuance of Section 21 authorization, and we've spoken in a number of webinars in terms of why we took that route for COVID related, and it was largely in vitro diagnostic tests, and that has been shared at length. But I think once we then start to register the products, this occurrence would be then minimized. Very important, and again, Dimakatso would have reflected on this, is our intention to ensure that we collaborate globally and we're part of these international forums. There's two, in essence, that we're part of. This is the International Medical Device Regulatory Forum, and we're also part of the African Medical Devices Regulatory Forum. And the benefit of these is that it enables us to understand, what the other regulators are doing, but also to harmonize our processes with those of other regulators, I guess for ease of review and ease of registration. It also allows us to ensure that whatever capacity building initiatives that these forums would have, we would then also participate in those as SAHPRA. Quite important is, again, being able to rely, because we recognize that we will not be able to assess everything, so we need to efficiently utilize our resources. There's a lot of learning that we've generated from applying Reliance for medicine registrations, and so we will be bringing some of those learnings into the area of medical devices. Again, we have adopted the guidelines and recommendations as published by the IMDRF, so the International Medical Devices Regulatory Forum. And the next step really is for us to be very active in IMDRF. We're already quite active in the African Medical Devices Regulatory Forum, but the intention is really to contribute a lot more and champion some of the initiatives. And I understand, I think Pauline, from AMDR, who is the head of the steer of the AMDR, would be, or she has already presented at this forum. So in terms of recent developments and what our strategic priorities are, really two major ones, and Makatso would have spoken around some of the operational ones. But from a strategic perspective, it's that for me, the big priority is that we really need to publish, these gazette, rather the regulations that have already been published. And we're really hoping that, that we should be able to finalize that quite soon. The harmonization, as I've already alluded to, of the Hazardous Substances Act and the Medicines Act, that is quite important because there is, in some instances, those gray areas wherein we're getting a lot of queries from industry around these. So we have, as I've indicated, started some early work of how to, on trying to harmonize these two. And then lastly, just to reflect on some of the learnings from COVID, and a number of you I engaged with you quite a lot. At the beginning of the pandemic, when we were, listing and giving Section 21 authorizations for a number of the diagnostic tests. But the key messages really for us and learnings is that we need to be open to learn from other regulators, but also apply what's locally relevant. There's a lot of agility we had to build into how we work, and really a sense of urgency. I think there were instances where we may have not been had the capacity to demonstrate that sense of urgency, but I can assure you that internally, when it comes to COVID matters, we have really stressed the urgency around this, and also keeping abreast of this rapid pace of change, rapid pace of information availability, etc. Collaboration was critical here. We had to work with all the relevant stakeholders to ensure that we are able to even access data that typically we wouldn't be able to access, whether it's from other regulatory bodies or even from some of the academic and other institutions locally. And while we were, responding to a pandemic and we had to be responsive, etc., being a regulator, you always have to be stringent because patient safety or the public safety is critical to us. And so we've been very consistent in a messaging that says that we make science-based decisions. And if the science doesn't support, or enable us to make a certain decision, we will then ensure that we generally get that science, through collaborating with others, etc. But really, we make our decisions based on science, and we have to remain stringent as the regulator. I'll pause here. Thank you very much.
Angelina, you can continue.
Oh, I'm sorry. I'm actually continuing and I was on a mute. Can you hear me now? Can you?
Yes.
Oh, thanks. Thank you to me. And I said, I was caught up by the last slide where you continue with this engagement, and there's an African proverb that if you want to run fast, run alone. But if you want to run far, go together. So for you to engage the stakeholders and the industry to make sure that you make this regulatory authority one of the most reliable regulatory authority and the best maybe, or amongst the best in the world. And now, following up on your transformation from the Medicines Control Council to the SAHPRA, obviously there's a lot of responsibility that were not part of the Medicines Control Council, and you had to take up that responsibility, including the recall. What are the main challenges that you are facing with taking all these additional responsibilities?
No, thank you. I mean, I guess three critical ones. The first is capacity. So while this is now included in our mandate, we now have to then adequately capacitate those areas. And it does take time, with capacitation, finding the right skills, finding a good fit, with individuals that we would be bringing on board. So it's capacity. Secondly, it's capability. As I said, finding the right skill sets at the right price. So we've been able to successfully bring some people who were with industry and bring them to, work with us on this. But there's a lot more that we need. We've got a fit for purpose structure that has just under about 500 staff at SAHPRA with very high technical skills, and yet we're not there, and the expectation is that we deliver on this mandate. So that's very challenging. I think the third challenge around this is balancing the financial resources available and the skill, this capacity need. And hence you see that, we are increasing fees. We're not fully funded by National Treasury. And so we do need to generate income from the fees that we charge you as industry. And so you will see when we then start registering products, we will be, before we start with that, we will be publishing fees that again, we will give you an opportunity to reflect on. So it's a balance, right? And one of the points we always make, and it comes up, is that we do need to ensure that as you pay fees for these activities, you get, value for the buck that you pay, in essence, in terms of the service that we provide. So we are on a big recruitment drive, very structured recruitment drive, but also being cognizant of some of our financial resource constraints. Thank you.
Thanks, Tumi. I think I said at the opening that this pandemic has really taught us a lesson, and this telescope focused on SAHPRA. Do you take that as being a positive or something? Did it bring some negative or positivity in terms of the world of South Africa focusing on SAHPRA?
No, I mean, it's a very good question. I think it was good. It's always good that the public knows the regulator and they know who to go to, when they have complaints about health products, etc. But also that they understand what the regulator does. What this has done, as good as it's been in terms of, creating awareness around who SAHPRA is, I think the challenge has also been that decisions of the regulator, which typically would be between the regulator and the applicant, are now in the public domain. And with availability of information and at times of misinformation, it then leads the public to at times make the incorrect conclusions. And so a big takeaway from us from COVID is the need for us to be more present in the media, to communicate a lot more, but also to communicate in our indigenous languages. There's a lot of critical messages that we need to share, and we just don't get to those communities that we need to.
Yes, I think it might also be answering the question about how we can, SAHPRA can educate the buyers in the public sector about SAHPRA licenses, and they continue to purchase medical devices from unlicensed companies, because we need that partnership to fight whoever. I don't want to call them enemy, but it's an enemy in terms of the regulatory transgressions. Okay. If I have to take other questions, there's a question from Simone. It says, thank you, Dr. Semete, for an excellent overview. What is SAHPRA's position on following the over-the-counter approach like FDA, TGA for low-risk products like complementary medicines and low-risk medical devices like bandages?
No, thank you for that question, Simone. And this is a matter that as we now are we'll be starting to regulate products. As I've indicated, as we review the classifications, we will then come up with very clear guidelines in terms of when something is a class A, what are you allowed to do with the class A, what are you not allowed to do? So we will provide that level of clarity like we've done with medicines. So there's definitely a lot of consideration and engagement required.
Okay. Thank you. And the next question says, SAHPRA issues licenses to manufacturers, importers, and distributors, in this case of medical device. But what is SAHPRA doing to ensure that Treasury and DOH make the license a prerequisite in their quotation requests and tenders in order to ensure that the correct products are procured by the states?
Yeah, very good question. And, you know, we've seen some of the challenges now with COVID. And I think that's the benefit, again, that COVID has brought, in that it has highlighted to, you know, the department as a procurer that they need to put these requirements in. I think with medicines, that's very clear, you know, from a tender perspective, and we work very closely with the directorate, and they know what to do. Since this is a relatively new area, we're finding that we have to then educate a bit more and, you know, highlight this need, because we've had tenders go out that didn't indicate, you know, the need for licensing, but we're having regular conversations with the team in the Department of Health.
Thanks, thank you. The next question says, thank you, Dr. Semete-Makokotlela. Industry also is really challenged in terms of the regulatory capacity and skill. I think you might have touched on that one. And this can result in inefficiencies. Would SAHPRA consider, as does the FDA, to develop and provide ongoing training and workshop for industry on the medical device regulatory requirements and new guidelines?
No, thank you. And I mean, we would encourage that. I mean, even for ourselves, we've just been able to secure support from the USTDA, wherein we'll be working with some of the US-based entities and medical devices to train our own staff. So we recognize the capacity gaps that we have. And so we're very thrilled to be able to work with the USTDA around this. You know, those who have, you know, affiliations in the US, etc., you'll start seeing the expression of interest and RFQs going out from USTDA for support to SAHPRA. So fully agree.
Thank you. And from Caroline, your opening slide alludes to the regulation of device in respect of efficacy and performance. How is this to be conducted?
Yeah, you guys are asking very good questions, and you know, things that we're also grappling with, right? You may have noted with COVID that we required, you know, that the tests undergo validation by the NHLS. But I think one thing that this demonstrated was the limited capacity we have in the country for doing this on a routine basis. And, you know, I was saying to Dimakatso that, you know, as we start to regulate the products, there will be those that we need to be validated, to be tested locally, whether it's pre-registration validation or even post-registration surveillance. And yet we don't have, you know, that local capacity. And I think herein lies an opportunity for those either in academia, etc., to set up such facilities, so that as SAHPRA, then we can utilize those facilities to conduct these assessments. If I look at, for example, with vaccines, we have the National Control Lab, which is the WHO accredited lab, and we do all the lot release testing, you know, and they in essence, to some extent, part of SAHPRA. For small molecules, again, we have to do the post-import testing, you know, working with Sanquam. So I think there is room for, you know, various institutions to set this up. But again, issues of conflict of interest become then very important. So, you know, we need to start having this conversation and saying, how do we as a country ensure that this capability exists? And, you know, our preference is always let it be a neutral party so that we don't find ourselves with issues of conflict of interest. Yeah.
Thanks for you to touch on the conflict of interest, because it was going to be my next question. And one other question from Andy said, will you be able to please elaborate the decision to change RUO products importation process to requiring Section 21 authorization, which seems to complicate rather than simplify?
So we have published a guideline for RUOs, but this may have been mainly for COVID-related products. I'll have a chat with Dimakato to see if we do have one that is a generic one, but I do understand that concern. It came up a lot during COVID, and that guideline is there for COVID-related products. And we may need to just expand it to other areas.
Thanks. There's one other one says, do you think that SAHPRA has done enough in communicating its role, which we've done this morning to the delegates, and how vital it is to the public health, particularly in its effort of approving safe and effective vaccines to South Africa COVID variants?
Yeah, I think, I mean, you can never communicate enough. There's always room to do so. And as I've said, I think we've been on, you know, various media platforms to talk around this. We've had a number of webinars, even around the safety, etc. But there's more to be done. As I said, an acute one I recognize is that we don't communicate in our indigenous languages. And so there's a big cohort in the country that we're missing.
Thank you. A lot more questions. Could SAHPRA explore reducing fees by focusing on value-adding processes? The person says, I've seen reports of huge admin burden on both sides, itself and its clients, for medical devices, and especially for the smaller suppliers.
Yeah. So if you took reducing fees, and we're still going to publish fees for registration of products, it's going to be an interesting conversation, because we still don't register products. So you know, that's going to come. I mean, the model that we use is a cost recovery model, and you know, it basically is that we're not driven by making profit or anything like that. We must just recover our costs. The benefit with medical devices is that it is a relatively new area, not as many staff or admin staff like we had with medicine. So even the people that we're bringing now, we're bringing quite highly skilled individuals, and the intention is to leverage technology, you know, to support a lot of their operations. We're not there yet, but that is the intention. And so I think we can have this conversation when we publish the fees and take it from there.
Okay. The next question by Simone is SAHPRA engaging with SEPs, CSIR, universities, TIAs for accredited labs to generate capacity, e.g. biocompatibility testing, IEC 60601, not only product performance testing. So it's just about the engagement.
Yeah. So I mean, it's again a very valid question, and we have engaged with them. Dimakato is part of the discussions that are led by the MRC under the whole medical devices cluster that the Department of Science and Innovation has established. And actually internally, we were saying that we need to utilize that platform to articulate, you know, where we're going, but also the gaps that we see at a country level, so that through that platform, these types of capabilities can be established. So yeah, we are talking to them indeed.
Okay. The next question, I think this from Caroline and from Sarah. Do you see a place for COVID self-testing kits in the future, and how will this be regulated?
Yeah, I was having this conversation with Dimakato. you know, and we were having a debate around it. I'm aware that I think it's the UK that does self-testing in a few other countries. And so we've agreed that we're going to meet with our scientific committee and deliberate on this. So yeah, so it's an ongoing discussion. And once we firm up our position, we will be communicating this. Yeah.
Okay. Thanks, Timmy. Next question from Nora. Can you please provide progress on ISO 13485 accreditation process? I'm not sure if this should be maybe directed to Makatso as she discussed that yesterday, but if you want to question.
Yeah, so the Makatso's here. Maybe I don't know if she'll be able to unmute and say something around this. The Makatso can speak to that, and if she can't, maybe she can type it in the chat.
I think the next question from Tanya, it's just a comment from Tanya. I think she's commenting on the fees. Okay. Let me see if there is any, I think we'll have questions. Okay. In terms of advertising Class C's, is there Class C's and D's advertising, is there a proposed policy or framework in place to allow for advertising of certain products within this classification, e.g. the contact lenses and glucometers? Not sure if, yeah.
I mean, the issue about advertising, we always look at the risk of, you know, someone who's not a qualified person accessing that product and utilizing it incorrectly, and therefore then the unintended consequences. And hence advertising is based on the class. So it's really is a reflection of the risk level for a specific class. Yeah, so that's really the consideration, the risk that it could pose. Similarly with medicines, you know, high scheduled products are typically not advertised, yeah.
I think Dr. Makokotlela is at hand to answer that question. Dr. Makokotlela, do you want to take that question? Yes. Dr. Makokotlela? Caroline?
Dr. Makokotlela is unmuted. I am not sure if there's a technical barrier on her side to her sharing, to her being able to speak.
Okay. I think if there's a problem, maybe she's still unmuted, muted. But I think on my side, as I said, this journey that you have started, or SAHPRA has started, it's really encouraging that we'll end up being one of those reliable regulators in the world. So I would like to thank you, Dr. Boitumelo, Semete-Makokotlela, and thanks for your courage and resistance and drive. We appreciate the insights and the information you shared with us today. And we look forward for future engagement between Summit and yourself. And thank you to our delegates, a lot of questions and really giving SAHPRA homework to do in terms of thinking when they take any step. And to your special guests and the session sponsor, Vital A. And before we close, I think there will be a video from our sponsor. Thank you, Caroline. Take care.